The unborn baby, a vulnerable seed for the future of a nation. Southern India, in the blistering outskirts of Chennai. Young pregnant women are gathered to undergo a simple test to learn if they have diabetes. Each of these women faces the risk of developing diabetes during pregnancy. 1 out of 10 mothers will develop this condition. She will need medical attention and education to prevent damaging her child and herself. Unfortunately, social structures place women in the developing world in a vulnerable position.
They are poorer, they have less influence on the development of their own situation, they get less nutrition, and their health is often much poorer.
Gestational diabetes ultimately threatens the lives of both mother and child. Developing diabetes permanently increases the risk of disability and the possibility of poorer lifelong health. Few of them are even aware of the risk, and that is a problem which needs to be resolved. Women face a long, winding road when it comes to accessing adequate health care.
The inequality between the genders has an impact on women in many, many ways. They have less influence on decisions in society, they get less education, and they have poorer health. And in practical terms, so much of the daily work falls on the women, not only farming or whatever other kind of ways that the family support itself, but also taking care of the children and the elderly, means that women have very little time to themselves to think about their own health and go to clinics where they are available. That is an enormous obstacle to the prevention of diabetes.
The well-being of the world's future generations rests completely in the hands of mothers and the societies in which they live. It all starts with caring for the pregnant women.
When you reach women at that situation where, of course, they are very open to any kind of dialogue, and you discuss nourishment and their whole way of life with them in that context, that will have an impact on the whole family, because it is women who cook and take care of the upbringing of the family.
A test has revealed that this pregnant woman has diabetes. She will now require medical attention.
Daily half an hour walking போகணும்.
Women who develop gestational diabetes face a 70% risk of developing type 2 diabetes later in life. Children born to mothers with diabetes during pregnancy have up to an 8-fold increased risk of developing diabetes.
We have detected her diabetes towards the end of the pregnancy. So she may be having a big baby, and if that is the case, we will have to plan her delivery before her due date itself. I wish she had come early so that we could have prevented so many more other complications which can occur towards the end of pregnancy.
Poorly managed diabetes during pregnancy may lead to spontaneous abortion, congenital abnormalities, abnormally large babies, the need for C-sections, and assisted deliveries. This baby boy was born with abnormal fingers and toes and a heart defect due to the mother receiving inadequate and poor treatment for gestational diabetes. Diabetes can cost the lives of both mother and child, or leave the family stigmatized and outcasts in society. The global diabetes epidemic is fueled by common problems in developing countries, such as maternal malnutrition and untreated diabetes during pregnancy. These can lead to fetal programming, a permanent change in fetus organs during the phases of development and growth. Later in life, this programming increases the risk of developing both diabetes, hypertension, and cardiovascular diseases. Helping pregnant women through a healthy pregnancy and delivery can potentially break the chain of diabetes and the related burdens.
The benefits will be enormous if we're able to convince women to take care of their health in a way that prevents diabetes. Not only for themselves personally and the future generation in not developing diabetes. But also because, as we know, diabetes is linked to a lot of the other non-communicable diseases. It's really a shortcut, in my view, to tackle a lot of the other problems, both health problems and developing problems.
In this rural area of Cameroon, mothers are part of a concerted effort to increase awareness about diabetes at all levels in this society.
And there's another form of diabetes, we call it gestational diabetes.
Initiatives to address diabetes issues during pregnancy can easily be integrated into existing programs for mother and child health.
Women are a key, both to the health situation of themselves and their families, but also to the general development of the society.
Targeting the reduction of gestational diabetes and the improvement of maternal health will not only improve health for those involved, it will also strengthen healthcare systems in general. Breaking the continuous generational chain of diabetes will empower women, liberate children from a troubled future, and benefit the global society as a whole. Women's health is a nation's wealth.